Well, this is always new technology is very interesting for us, and obviously all new technology brings benefits not only to the patient but also to the surgeon, the technique, making the procedure faster, better, safer especially. Well, the CataPulse, we've been almost 45 years with ultrasound. Ultrasound is energy. The idea of going into the CataPulse is to getting rid of the ultrasound and that energy. That energy that we apply with the ultrasound, not only is it focused to the piece we're trying to emulsify, but also it bounces off to the endothelium, it bounces off to the iris. That produces more inflammation and more. So the idea is to get rid of the ultrasound, get rid of the heat of that energy that produces inflammation in the eye. We've all had those cases where we see we don't use any ultrasound and those eyes are even better than when we apply the ultrasound. So why not get rid of the ultrasound altogether and apply all the benefits of not using ultrasound energy? One of the biggest advantages that we see with the CataPulse is the followability. The ultrasound tends to repel any pieces that we try to bring in. The ultrasound pushes it away, so the way we go around with it when we go to ultrasound is we increase the flow. With CataPulse, we don't have that problem. The followability of the pieces, it's like the tip has a magnet for the nucleus, and it's very easy to work. We reduce the flow, so by reducing the flow, we have safer endothelial cells. The advantage of having better followability is we need less flow of solution, BSS solution, and also we are preserving more endothelial cells. Since we're going and doing surgery now with the premium lenses with younger patients, we need to preserve as many endothelial cells now, so it's a big advantage. Yes, I think so. It's a very good combination, for example, with the femtosecond laser. With the femtosecond laser for cataracts, it's a very good complement. We are using the best technology in these eyes, getting everything precise, reduce the inflammation, reduce and increase the safety of the procedure. Yes, definitely. The CataPulse may be used without the femtosecond. The only thing that the CataPulse requires right now, to date, is that we do have a pre-chop, and we can do it manually, or we could do it with the femtosecond. The main principles that make the CataPulse effective is the pulsed vacuum. Pulse vacuum is that stop and go of the vacuum, and that is what makes the piece of nucleus go through the cannula and outside of the eye. It's that when we use pulse vacuum, there's the possibility of reducing the flow of the eye, and so we're conserving endothelial cells. Also, as we do this pulse vacuum, we never actually let go of that piece of nucleus. So the followability, there's nothing repelling that piece of nucleus. So it's being removed from the eye very efficiently. Another of the principles that make CataPulse very effective is that we are reducing the incision size. We are now using a 1 millimeter cannula that goes through a 1.4 step wound incision, and we can do bimanual technique in this. Yes, CataPulse is much safer than Phaco. First, we get rid of the ultrasound. We stay away of the metal tip that always has the possibility of having a little metal burr and damaging the posterior capsule. The heat that is not present in the CataPulse as opposed to in Phaco in ultrasound also infers that there's going to be much less danger with the CataPulse.